So with all of that said, I'd like to introduce Jay, who has dedicated his career to helping people understand the often confusing world of retirement planning. He is licensed through more than 100 companies and has assisted more than 1,000 clients throughout central Pennsylvania. His expertise in data analytics and attentive listening allows him to give unparalleled counseling to our community. So we are very excited to welcome Jay this evening.
Thanks, Ashley. Appreciate it. Hi, everybody. Again, like Ashley said, my name is Jay, and thank you so much for attending our presentation today with regards to Medicare. So the goal for today is just to kind of go over the basics of Medicare, the two main types of options available, and then go over some rules to follow within the program, and why it's really a good idea to have some kind of assistance when you go into this realm, because it is overly confusing. So I'm going to turn off my video, I'm going to share my screen, and we will chat about good old Medicare. So here we go. All right. All right. Ashley, if you could, do you guys see the slideshow?
Yes, we can see it.
Okay, awesome. All right, so let's get going here. So again, the nonprofit that I work through is called the Financial Education Partnership. It's based down in Maryland. They reached out to me a couple years ago to bring a nonprofit perspective to education, to retirement planning. So we're excited to help you guys out, and we'll talk about more about myself and what we can do for you moving forward here. So why or how is FEP different than everyone else? Again, we're a nonprofit, so we're not geared towards making a sale. We're geared towards advice. I've been in the market since 2008, so I've worked with every company known to man, and that's helpful for you when you're trying to make these decisions, because I can say, hey, I know these companies have taken good care of people, or I've had a difficult experience with them in the past. Our program that is uniquely different than everyone else's, we call it T. It's called True Extensive Analysis. And what this really means, and we'll go into more detail about this in a little bit, is we dive in deeper than everyone else. We talk about doctors and medications and needs, and so just really want to sell you a policy, and we're not geared towards that. We really just want to make sure you get the best healthcare option possible. We are independently contracted with every carrier. So again, if it's UPMC or Highmark or Aetna or whoever it may be, we can help you out with that, and we can give you clear advice about what option best makes sense for you. We also provide exceptional customer service, and this is something that's very different than everyone else. So not only can we help you dive in and get the right plan for your specific needs, but we're also there after the fact. If you have an issue with your plan, or say you might want to find a second opinion, or whatever it may be, we'd ask you to reach out to us, and we'll be happy to reach out to the companies on your behalf and try to get you a clear answer about whatever challenge that you're dealing with at that point in time. And because we care about the quality of care, but also we're here after the fact, we actually have a very high client retention ratio. We actually have 98% persistency, which means that year after year after year after year of doing this work in the level that we do, we've actually kept 98% of our clients, which is unheard of in this industry, because most people, for how competitive this market is, doesn't even keep 2/3 of their book. But we keep a very high retention ratio because, again, we're here and we make sure every year that you're getting the right advice year after year after year. Not only if you have questions about just Medicare, but we can help you out with other things, retirement planning wise. That's what FEP does. So if you have questions about income planning or taxes, or if you're having troubles paying for your medications and you want to know about Medicaid or the extra health benefit or PACE, we can help you out with that as well. Since again, we are a nonprofit, we don't ever charge any fees. So we will never charge you a fee to give you the information. We never expect anything in return. Because again, we're more focused on how we can help our community versus what we can make off of them. And we are aware, in the new world that we're living in, that some people don't feel comfortable in getting together, and we respect that completely. So if you do want to talk about your that if you want to handle the enrollments, we can do that for you as well, all online. So we're here to help. All right, so let's get into the Medicare program itself. Now it's going to start making some sound and some jingles. Don't worry about that. I keep on trying to delete them, but they keep on coming back. So no big deal. So the first and most important part, and like I said, there's a little jingle there, is you, because you are the recipient of the Medicare benefit. So what happens is whenever someone turns 65 or they've been disabled on Social Security for at least 2 years, they receive Medicare. So Part A, most people don't pay for if you've worked 40 quarters. And Part A covers your hospital insurance. So that's any facility-based care. So hospital, nursing home, rehab center, that's what that pays for. It has its own deductibles and its own copays. And then you have Part B. Now, B is what you have to opt into when you turn 65, if you want it. And what that covers is everything outside of that facility. So your local doctors, lab services, physical therapy, x-rays, that kind of services, or those kind of services are what's handled by Part B. The premium for Part B as of right now is $144.50 per month. It does get adjusted for higher income individuals. It can also be waived if you're at a lower income position. So if you're not sure if it's a struggle, reach out. We'll definitely help you in understanding what the options are at that point in time. Now you'll see within this circle, or this oval, I should say, that you'll see that 80% there. So Medicare itself will cover 80% of your services. You can have just Medicare. A lot of people want to tell you, you have to do this, then you have to do that. Actually, no, you're not required to do anything. It's definitely suggested to have some other benefits to cover that 20%, but you're not required to have anything else in addition to Medicare. But it is suggested, and here's why. When you have to pay 20% of a service, and if that service is a $100,000 heart attack, that's a huge bill to have to be liable for. So it's definitely suggested to have something, but it's not required. So now what everyone had before 2008 was a Medicare supplement, otherwise known as a secondary or a Medigap. So you'll notice that line between the blue oval and the gray oval. So the way it works is in this model, Medicare is your primary. They get billed first for everything. And then depending on the plan that you choose with the supplement, that gets sent to the supplement, and then the supplement covers the 20% for you. So the supplement is your health insurance, and then you need a Part D plan. You see at the bottom of that gray oval. And what the Part D plan is for your medications or your drugs. So again, primary, secondary relationship. Let's talk a little bit more about a supplement. All right, so a supplement, again, is a secondary to Medicare. They pay after Medicare pays. There are plans A through N available. I'm not going to go through all the plans because it's very confusing, but just being aware that every plan has a different copayment and deductible structure. So some plans might cover everything. Some plans might cover something. Some plans might cover a limited amount of things. And if you're not sure, we can help you understand what those differences are so that you have the proper coverage for the future. Now, something to keep in mind, Plan C and F. That is a plan that typically covers all of your out-of-pocket expenses when you're on Medicare. They cover all your deductibles and your copays and so on and so forth. Now, Plan C and F are no longer going to be offered after 2020 to new enrollees. So if you've turned 65 before 2020, you can still get Plan C or F. And anyone who's turning 65 from 2020 on will not have an opportunity to sign up for a Plan C or F. Not a big deal. There's a lot of good plans out there, but we bring this up because when there's no one new coming into a plan, no new younger enrollees coming into a plan, there is a risk that the rates for Plan C and F could start increasing at a pretty aggressive rate. So if your plan is a C or an F, and you're starting to see 15 to 20% rate increases, you really should reach out to us and we'll help you find another option to help you save some money. Because the last thing we want you to do is spend way too much money on an insurance benefit when you could probably have it covered through another company with another plan for a lot less per month. Now, Plan G and Plan N are kind of the two new go-to plans in this market. The rates are very strong. So again, if you have a Plan C or F and the rates are getting a little too expensive for you to handle, please reach out, let us know. We'll be happy to talk to you about other options. and still keep you in the similar kind of benefit pool. Now, with the supplement, it does not matter what company you have, they all provide the same base benefit. So if you have a plan G from Aetna or AARP or Royal Neighbors or Thrivent, they all provide exactly the same benefit. The only difference is what you pay for the plan now and what you potentially could pay for the plan in the future. And that's a very important distinction to understand, because we don't want to see in a plan where the rates are going to go really high as you get older, because then it won't be affordable and then you'll be, put in a difficult position. That's the last thing we want for you. You can switch a supplement any time of the year. This is a confusing time of the year because this is the annual enrollment period, and that only reflects for Medicare Advantage or drug plans, but not supplements. A supplement you can change any time of the year. So if you have a Medicare supplement through any company and you get a rate increase notice around your birthday, or they have another rate increase in May, you can call us any time of the year and say, look, my rates went up. What are my options? We'll be happy to talk to you about that and give you a good direction of what else is available to you for the future. If you're turning 65 or starting Medicare Part B for the first time, there's a very important rule to be aware of. Now, when you turn 65 or start Medicare Part B, you have what's called guarantee issue rights. So that means whatever is going on with your health, you can get any supplement you want at any time, okay? That's very, very, very important because if someone has, say, cancer or has had a heart attack or stroke or has a debilitating issue, they have to accept you in that plan at that point in time. Now, 6 months from your enrollment date. So if you're now 65 and a half or 70 or 75 and you say, no, I had some expenses, now I want to go back to that supplement. At that point in time, the Medicare supplement plans can ask you questions. And they can say, do you have cancer? Have you had a stroke? Have you had this? Have you had that? And they don't have to take you. Now, Medicare doesn't have any pre-existing conditions because Medicare covers 80% of the bill, but that 20% through a supplement, they absolutely can ask you health questions if you do have a complicated health history. So that's something to keep in mind. And again, we're here to help you with that guidance so that you have that option or that knowledge, more importantly, in case something were to occur. It's also important to realize too with supplements, they do offer household discounts, even for siblings. I had two brothers that lived together. And they both got a discount on their plan because they're both with the same company. So it is common, I don't know why, but for some people, say, Mr. has AARP and Mrs. has Aetna, they really should be on the same company because they can both receive a discount on their plan for being with the same company. So it's definitely a suggested place to be if you're going to both have a Medicare supplement plan. Some supplements also offer extra benefits. Some offer gym memberships. Some offer dental discounts, some offer vision discounts. So if your plan doesn't offer those benefits, reach out. We'll tell you if there's another option out there that makes a lot of sense for you. And again, if your rates have risen and they're getting to a point where they're eating up a good portion of your monthly income, please reach out before it really, takes a burden on you. We don't want that to happen because there's a lot of good options in this area. We're lucky that we live in the state. There's a lot of plans and a lot of good ways of going about it. All right, so those are the supplements. Now we're going to talk about Part D. Again, Part D is your prescription benefit, okay? So that covers all of your maintenance medications and the specialty medications as well. So now Part D, this is the part that you have to look at every single year. And these are the plans that change every year, and you have an opportunity to make a change to it from October 15th through December 7th. Very important to take a look at the differences with these plans every year. They change. They are contracted on an annual basis, and they can change their formularies, they can change their premiums, they can change their structures every year. So it is vitally important to go through your medication costs with your plan every year. We do that automatically for our clients, but if you do not have someone that does that for you, please reach out to us. Because you can save a tremendous amount of money, or you can waste an enormous amount of money by being with the wrong plan. I always like to go over these 3 statements every year because this is helpful to understand. So what's the difference between a deductible, a copay, and a coinsurance? So a deductible, like your car insurance, is what you have to pay before the insurance pays for anything. So if you have a $500 deductible, you have to pay the first $500 before the insurance pays. Same thing with a car insurance, right? So if you get into fender bender and they want a $500 log, you have to pay that before they're going to pay for any repairs. Same thing with your health insurance and your drug insurance with Medicare. So if your deductible for your drug plan is $500, you have to meet that deductible before your plan is going to pay. Now, copay, after deductibles are met, is a flat dollar amount for a service. So if you go get your blood pressure medication and it's $2, that's a copay. Now, coinsurance is a percentage of the cost. Again, a percentage of the cost. So if they say it's 20% and the pill's $100, you'll pay $20 for that service. That's very important because next year, there are going to be some plans that are going to switch from a copay to a coinsurance. So this year, you might have had a $40 copay for a brand name medication like Xarelto or an insulin. Next year, they're going to go to a 20% coinsurance. Doesn't sound so bad, but if the medication cost is $400, now you're spending $80 for that same medication. And there again, this is why it's so important to go through these plans every year so you're not caught with a big old bill for your medications. And also what's important too is there's some plans that are going to exclude tiers 1 and tier 2 medications from the deductible. And what a tier is where medication falls in its copayment structure for a plan. And what all that jargon means is basically a tier 1 would be your preferred generics, your low cost for the insurance company and for you. Tier 2, your non-preferred. Tier 3, your brand names. That's when you get into the more pricey medications. Tier 4, your non-preferred. Tier 5 is your specialty, your very expensive medications. So it's important to know where your medications fall in those tiers, because you could be with a plan that you have to pay a deductible for a med, but you could have switched to a different plan, and that plan may have excluded you from having to cover that deductible. So you might have avoided spending that first $500 before your plan pays for the medication. It's real important, and it's real confusing because there are 100 different drug plans. I don't know why, but there's going to be 100 different plans available in central Pennsylvania next year. And there's some plans that only have deductibles for tier 3 and up. There's some plans that have deductibles for tier 2 and up. There's some plans that have deductibles or coinsurance for tier 3. It goes on and on and on and on. Make it easy on yourself. Reach out to us. We'll keep it clear for you. And again, we'll make sure you're up to speed with it every year. Also, really important to make sure you're going to the right network provider. So if you have a plan and that plan has a preferred network of pharmacies, so say it's ABC Company, and ABC Company wants you to go to Rite Aid versus CVS or vice versa, it's real important to make sure you're going to the right pharmacy, because you can spend a tremendous amount more money. So I'll give you an example. I can't say the exact company name because we're not allowed to do that, but there's a company that if you went to, and the difference is simple, if you went to Giant and you wanted to go get your inexpensive generic medications, just a 1-month supply, they will charge you a $20 copay. If you went to CVS with that same company, it's free. And that's real important to make sure you're going to the right pharmacist, because you can spend a tremendous amount of money in extra copays when you never really had to. All right. So also, it's also very big for next year. There's only going to be a certain subset of Part D plans that will be covering insulin for a low copayment. Insulin is very expensive. It's been around for a long time, but there's a lot of varieties of it. And a typical box of those pens, those insulin diabetics use, are around $500 to $800 a box per month. Now that's the full cost, not what the client pays. The clients typically pay $50 or so for that box. Now, with the problem that a lot of insulin-dependent people deal with is there's a threshold for all prescription drug plans where they say once you spend so much money, the prescription plan reduces how much they're willing to pay. That's called the donut hole. And the way it works is when you spend about $5,000 between what you spent on your copayments and what the insurance company spent. So if that medication is $500 a month, by the time October comes around, you spent $5,000 between yourself and the insurance company. And at that point in time, you hit the gap in coverage or the donut hole. And when you hit that donut hole, instead of paying your $40 or $50 copayment, now you go to 25% of the cost. So if that medication is $800, you're paying $160 for that medication now. And that's a big deal. It's a real burden for a lot of people, especially going into the last quarter of the year. So next year, there's going to be certain companies that are going to cover insulin for a low copayment, as low as $5 per month for the entire year, even when you're in the donut hole. So if you know of anyone who's insulin dependent, please, 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 please have them reach out, because we really want to make sure they're in the right plan and they're not going to get burdened with a big bill, because that is the biggest scare for any insulin dependent person, is how expensive their insulin really is. So again, if you know of anyone who's insulin dependent, please let us know. All right. So, and Envision. So if you guys have Envision, keep in mind that Envision is changing their name to Elixir. The price point is tripling in cost. So if you know of anyone that has that, or you're confused about what to do about that, please reach out. This does happen every year, but we can make sure you don't get stuck in a plan that's very expensive for the following year. All right, so we've talked about supplements and we've talked about Medicare. Again, excuse the sound effects. Now we're going to talk about the other plan that's been available since 2008, and it came about from a program called the Medicare Modernization Act. And what happened was Medicare in the early 2000s, I should say the government, saw that the Medicare population was going to double from about 2009 to about 2020, about 40 million people to over 80 million people. And Medicare itself said, look, we've got the funds to take care of this, but we don't have the manpower to handle the claims. It's just too much of a volume for us to take on and keep up with. So they opened the doors to private health insurance companies. Aetna, Capital Blue Cross, Highmark, Humana, you name it, they opened the doors to them. And they said, look, if you're willing to offer up your network and the associated discounts you've created with these doctors, we will allow Medicare beneficiaries to come work within your network. We'll pay you to do so. And in turn, we just want the discounts and we want you to handle the paperwork on the billing side. So that's where Medicare Advantage came from. So if you look down here, you'll see Medicare Advantage is a combination of parts A and B, and they call it Part C. So what it is, instead of using Medicare as your primary, the Medicare Advantage plan actually replaces your Medicare. So the insurance company you go through is billing Medicare on your behalf for those services, okay? So you'll notice on the right, we have that line between the blue oval and the gray circle, or the gray oval, that primary-secondary relationship. You'll notice on the left side, there is no connection between the two. And that's not saying you don't have your Medicare. You still have to pay for your Medicare. You still have to be a part of Medicare to get this Advantage program. But you have to understand that this Medicare Advantage plan is your end-all, be-all for your care. It isn't, well, my Medicare Advantage plan didn't play, so my red, white, and blue Medicare card will pay. It does not work that way. It is your Medicare Advantage plan that is taking care of all of your services. It's not a bad thing. I'm not saying it's bad or the wrong way to go about it. It's really confusing for a lot of people, and we always want to bring it up and try to make it as clear as possible to everyone that it is your primary and your only insurance provider. Again, not a bad thing, but it is the way it works. So let's go into a little more detail about Medicare Advantage. All right, so Medicare Advantage, there are two main types. There's PPOs and HMOs. There's some other types out there, but the two common ones are PPO, HMO. And that's the easiest way to know if you have an Advantage plan or you're talking to someone about an Advantage plan, if it has PPO or HMO in the name, because again, these companies are utilizing a network to get specific discounts from the doctors and the hospitals to keep your costs low for you and also for Medicare. So again, if you have PPO or HMO in the name, then you know you have a Medicare Advantage plan. So let's talk about the difference between HMO and a PPO. So an HMO, if you think like, if you want to take a picture in your head and think of like a map of Dauphin County, we got that little side profile of a guy's face, right? So an HMO basically says, if you had to look at a map, and these are all the points, these are all the doctors we want you to see within this map. So you can see a doctor at Hershey, you can see a doctor at Pinnacle, you can see a doctor at Holy Spirit or WellSpan. Doesn't matter. They want you to use those doctors, and you can use those doctors. But now if you want to go down to Philly, or if you want to go to Pittsburgh, or if you want to go to Manhattan, or Cleveland Clinic, or California, you don't have that ability with an HMO. They will cover you under emergencies out of network, but if you want to get a second opinion from another physician outside of your primary network, you don't have that ability to do so. Now, a PPO, same idea. They want you to see providers here first. Those are your preferred providers. Those will give you the lowest co-payments for your plans for the year, okay? Now, a PPO, though, says if you want to go to Hopkins, or if you want to go to Philly, or go to Manhattan, or Cleveland, or California, you can. They will charge you more to be there, but you do have the opportunity to go out of network if you need to, okay? Now, it is important to realize there are going to be many Medicare Advantage plans next year that are going to say, you're in network copay and you're out of network copay, it's the same thing. So let's say if it's $5 here, it's $5 everywhere. If it's $25 here or $300 here, it's $300 everywhere. That's a very nice benefit for you. It does not mean that it's a national network though, okay? So if you are going to be traveling and you're going to be staying in Florida for 3 or 4 months, just because your copayment here is the same as it is everywhere else does not necessarily mean every doctor is going to accept it, because they have to accept Medicare assignment to do so. And I always bring this up because there's a lot of people like to sell it and say, well, no matter where you go, you're covered. There is truth to that statement, but you have to be aware that if you're looking for something systematic, like a routine doctor visit, they have every right to say, no, we don't want to take it, because they have no idea what they're going to get paid. So if you are traveling, you want to make sure that the program you're choosing here has access to network doctors where you're going to be going. Again, not to be confused with a national network. It's a really great program, though. I do like it a whole lot, because it's nice to know that my co-payments will stay low if I do need to go out of network. I just have to be careful with the fact that not every doctor has to accept it. Again, like we talked before about the pharmacy, you really want to make sure you're using the right service provider. Labs are a great example. There are some companies that if you go and get your lab work done at your physician's office, they won't charge you a copay. But if you go to a Quest or a freestanding lab, they'll charge you a $40 copay. And there's other plans to do the exact opposite. If you get it done at your doctor's office, they'll charge you $40, but if you go to Quest, it's $0. That's the kind of confusing thing that we help you understand, so that you're not wasting money on copays. But if you are paying high copays for lab services or diagnostics like EKGs or sonograms, please reach out. We can definitely help you get some guidance on where you're supposed to go, so you don't have to waste a lot of money on copays. The nice thing about Medicare Advantage plans is they typically come with your drug benefit built in. So before, we talked about a supplement and a drug plan. These plans usually roll it all into one plan to make it easier on you. But because of the drug benefit, it is vitally important to make sure you are in the right plan every single year. I'll give you the greatest example that just happened this week. I had a lady with the plan, good company. They came out with a $0 plan. Still sounded the same, still the same logos, very good copay structure. With her current plan that she was paying $50 a month for, her medications for the year were roughly $120, okay? If she went to the $0 plan from the same company, her medication costs went up to $5,000 for the same medications. I couldn't believe it either. I was really surprised. I checked it like 5 times to make sure I was right, but I was. So it is really important to make sure that you're not just looking at what the premium is going to be, but actually what your copays are going to be for those medications, because you could waste a tremendous amount of money being with the wrong plan. Some will cover insulin at a low copay. So before, like we talked about the insulin buyback program, there are certain companies, not every one of them, that will offer an insulin copay as low as $5 per month. So if you have any friends or if you are insulin dependent, please reach out, because we really want to make sure you're with the right plan, so you're not going to be dealing with that donut hole in the future. Some of these plans also have extra benefits: dental, vision, hearing aid, support services, DRIM, acupuncture, which is brand new for next year, transportation services. So they can give you a lot of extra services for their plans, which is really a nice thing about it. But realize, just because a Medicare Advantage plan has a low premium and includes your drugs and they have all these great things, you'll have copays. So, if you go to the ER, it's $90. If you go see a doctor, it could be $5 to $10. If you see a specialist, it could be up to $45. If you have outpatient surgery, it could be $325. If you go to the hospital, it could be anywhere from $250 to $1,500. So you have copayments that you have to be aware of. Now, with the copays, it is important to realize that all Medicare Advantage plans in this state have what's called a maximum out of pocket. All right, so remember this copays I just talked about before. If you had radiation therapy and it's $200 a day, or you had hospital stays or nursing home stays or whatever it may be, once you hit a certain threshold, you stop paying your copays. So a lot of plans, the threshold is 6,700. Some plans are as high as 7,500. Some plans are low as 3,400. That's really important to understand what that maximum is, because that is your spending limit. So if you have a terrible year and you have all these services come up and you rack up $10,000 in copays, if your plan has a $5,000 max, you stop paying at $5,000. Insurance does not stop. Insurance keeps on going. It just says this is your financial maximum for a year. So that's a very important thing to have available to you as time moves on. Okay, so let's go into a little comparison chart that I do. Now, this is a Medicare supplement versus Medicare Advantage. To be completely honest, I'm not saying I like one or the other, all right? This is really just to help you understand what kind of runs in the back of my head when I'm thinking about a Medicare supplement versus a Medicare Advantage plan. It is really dependent on your specific situation, on your budget, on your medications, on your concerns. It is not just supposed to be because it's cheap or because it's expensive, you're supposed to go with this plan. That's not our goal. Our goal solely is to make sure that we give you all the information so that you can make a clear decision for the future. So Medicare supplements, some pros, out-of-pocket expenses. Before we talked about ER and ambulance ride and hospital stays and radiation therapy and outpatient surgery and MRIs. With most plans, with Plan G, C, or F, they cover all those expenses. As long as it's Medicare approved, the supplement will cover that. So you have no out-of-pocket costs for services. And it's very, very valuable to have that service available to you. No network. So as long as a doctor accepts Medicare, you can see that doctor anywhere in the country. So if you want to go to Hopkins, you want to go to Cleveland Clinic, you want to go out to Sloan Kettering, doesn't matter. You have the ability to do so as long as they accept Medicare. Now, the big con to the supplement is the monthly premium. You know, some people, I just had a guy tell me he's 74 years old and his premium for his Medicare supplement was $265 a month. You know, that's a big amount of money. That's a lot for someone to have to afford. So it's always important to be aware that there are other plans available that can save you some money, but really that you don't want to be put in a place where, you know, to either get groceries or pay for my insurance. That's the last thing we want to see anyone deal with. Eligibility. Before we talked about the fact that when you get signed up for Medicare for the first time, you're guaranteed an issue. You're guaranteed to be accepted in any plan you want. Now, if you wait 6 months after that initial enrollment period, they can ask you questions. So if you want to sign for a supplement, say when you're 75 years old, if you have a complicated health history, they absolutely can say we don't have to take you. And that can be a burden for some people, especially if you already have a complex health issue. They don't provide the extra benefits, dental, vision, hearing. And that's a big problem for many seniors. I don't think of any senior that hasn't dealt with a teeth issue or a hearing issue or a vision benefit. So it's unfortunate that they don't offer that benefit as well. Maybe someday they will, but as of right now, they do not. Now, medically needed services. So what I'm talking about, like, is glaucoma, or, you know, if you have Meniere's disease with your hearing situations, or, you know, God forbid, you know, oral surgery because of cancer, that's covered by Medicare. It's like teeth cleanings, glasses, hearing aids. That's what I'm talking about when I mean dental, hearing, or vision benefits. Now, Medicare Advantage, big pro to it is the premiums. There are going to be 65 different Medicare Advantages available in Central Pennsylvania next year, and over half of those are going to be zero premium. So it means you don't pay anything for them per month, okay? And they typically include your drug plan as well. And they also include other benefits like dental, vision, hearing, and those kind of things. But keep in mind, when you have a low premium, you're going to have co-payments. When you see your doctors, when you have surgeries, when you have any kind of service involved, you're going to have co-payments. So it's very important to realize that, you know, there's a give and take there. They are very good. I like them a whole lot, but you have to be aware of what the co-payments could be if you need these services. Again, the big con with it is the annual changes, and this is the part that drives us all crazy. Is these plans can change a lot of stuff every year. They're allowed to do that. They're on a contract year to year to year. So if they decide to increase the hospital copayment or add a deductible or change the network, All right. If you don't have someone who's calling you every year and getting you up to speed on what's happening with your plan specifically, and is being aware of what you need, it can be a big burden. And we always make sure that we contact our clients every year and we keep them up to speed. But if you don't have that service, you really should reach out to us, because we do want to make sure that you're not going to be caught with a big surprise. The network can be a big issue. There are some big companies here that don't work with some of our networks. Some companies don't want to work with Penn State Health. Some companies don't want to work with WellSpan. Some companies don't work with UPMC. So it's very important that when you are looking into a health insurance plan, specifically a Medicare Advantage plan, that you do have a network that will allow you to go anywhere you want to go, okay? And the copays, like we've said before, like that lady, I have a lady who has lung cancer, and her radiation therapy copay is $200 a day for 8 weeks. It's a pile of money. Now her maximum out of pocket is going to limit her expense, like we talked about before, but it's still a lot of money to have to worry about. And that can be a real detriment to a lot of people. All right, so let's keep on moving here. So some important rules to follow on Medicare. I always have to go over this because this can be kind of confusing. So observation versus admittance, otherwise known as outpatient versus an inpatient stay at the hospital. So if they keep you under observation, you are an outpatient, okay? When you're admitted, you're an inpatient. So why that's important is under observation, you could have more copays, versus when you're admitted, you typically have one copayment either per day or for the entire time that you're there. Real important, because that's your copayment. It's what you have to spend out of your pocket, okay? Now the rule is, and it changes every year, but the rule right now is if you're there for 2 midnights, you're supposed to be admitted. So again, 2 midnights, you should really ask to be admitted to reduce your expenses over time, all right? Ambulance membership groups. A lot of ambulance corps offer a membership. And they say, if you give us $50 a year, you can be a member of our group, and we'll give you, not preferential treatment, but we'll give you, some better service opportunities. It's important to realize that if you have a Medicare Advantage plan, and that Medicare Advantage plan, like a PPO, has a copayment of, say, $250. If you are going to be a member of one of these groups, of one of these ambulance corps, ask them, if I have a copayment of, say, $200 with my plan, does that copayment get waived? If it doesn't get waived, you really have to ask them what the benefit of the membership is. Some of them do waive it, some of them do not. But it is important to make sure you're getting a benefit from the membership program itself. Urgent care. Urgent care copays are lower than ER copays for almost all Medicare Advantage plans, usually around $40 to $50. So I often tell people, if it's something minor, twisted ankle, hurt foot, cut, mild cough, definitely check out the urgent care programs. There's a lot of them there. They're very quick. Now, if it's something serious, heart attack, stroke, a bad contusion or something like that, go to the hospital. Don't mess around. Go there. They'll take care of you. But from our own personal experience, the urgent cares have been pretty helpful for quick service for low cost. Prepaying copays and deductibles. This is something that's really important to talk about. And the reason is, when we talk about Medicare Advantage plans specifically, and say you go in for cataract surgery, and the cataract surgery copay is $250 per eye. So you have a $500 total cost. It is real important to understand that if you go to that doctor's office and they say, well, you have to pay your copay before we do the service, that's not necessarily the case. I'll give you the best example for myself. I had nasal surgery back in February. They went up there and they opened it all up, and the surgery was $136,000. My wife works in the med center. We pay for med center insurance. Even after all that, my copayment was $3,000, which still to this day is mind-boggling, because we spend over $7,000 a year on the insurance. So my copay was $3,000. And I said, they called me 2 weeks before the surgery, said, this is what you have to pay. I said, I don't have the money. They said, okay, we'll set up a payment plan with you and we'll take care of you. That's the same thing the doctors are supposed to do at the eye doctor's offices, or if you have to have outpatient surgery for your hands, or, maybe you're getting a shot in your hip. That's the kind of thing that they're all supposed to do. And if they're not willing to do that, I would urge you to go to a different physician that will work with you on that, because there's a lot of people that are struggling to get that copayment together. And it is vitally important to get that service done so that you don't deal with any difficulty. And again, if your provider is not willing to work with you on that, I would tell your insurance company, because that's very important that they know that. But I'll also tell you to find a different provider so that you're not burdened with not being able to get a service because you're worried about covering that bill. Every health system in our neighborhood wants you to go to the doctor, and they will work it out with you if you have a copayment. The last thing they want anyone to do is to suffer and potentially put themselves at risk because they don't have a copayment handy. All right. 3-day rule for nursing facilities. This has to do specifically with a Medicare supplement plan. So a secondary plan. This rule is still in place. We don't quite know why. But if you're going to be at the hospital and the hospital says, you know, we want to send you to a rehab center after your hip surgery because you're showing you have some extra needs that we can't provide here, you really have to be in that hospital for 3 full days. If you're not in there for 3 full days, there is a chance that Medicare may not pay for the nursing home stay. I don't understand why they have this rule still, but it is in place. So again, if you're going to have a Medicare supplement plan and they want to put you in a facility for a couple of weeks just to get you nice and strong to go home, you have to really be in the hospital for 3 full days. If they're really pushing you to get you out in 2, bring up this point and say, will Medicare cover my service? And get someone to make sure that is going to be the case so that you don't have a $2,000 or $3,000 bill from your nursing home stay. Now, Medicare Advantage is different. Medicare Advantage actually declares the length of service up front. So if they say, Mr. Smith is going in for hip surgery. Okay, we know he's going to need some rehabilitative care. We're going to cover 2 weeks for from the get-go, which is fine, which is, you know, a fine way to go about it. Now, the one thing I tell everyone to be aware of is, you know, if Mr. Smith is in there for the 14th days and he's not getting a whole lot better, but he's getting slowly better, but he's not ready to go home yet, don't let them tell you have to leave on the 14th day. If you're getting close to the end, they're saying, you know, the insurance is going to run out, call your doctor. Your doctor has a right to say when you're supposed to go home. And if they can say, well, she's not or he's not weight bearing yet, and really he lives alone and he's at a high risk if he goes home, because the last thing the doctor wants, the last thing Medicare wants is for someone to go home from that facility too soon and get re-injured and possibly get injured worse and have to come back in the hospital and then have to go through that whole process all over again. So you do have a say, you don't have to be pushed out, and you do have the ability to ask your doctor to reevaluate your services and extend it accordingly, okay? Now, one thing that we run into in the past, which is very surprising, some Medicare Advantage, some nursing homes, I should say, every Medicare Advantage plan typically covers the first 20 days at a facility. So the first 20 days, you don't have a copayment. Now, from 21 to 100, after 100, all insurance stops, but from 21 to 100, you could have a copayment of anywhere from $175 to $200 a day when you're in the facility. So that's a lot of money to have to be liable for. Now, remember we talked about that maximum out of pocket. So that maximum out of pocket relates specifically to that. So if you get placed in a home and you're there for, God forbid, 90 days, that maximum limits your expense for that situation to $5,000, $7,000, whatever your maximum is for your plan. Now, the nursing homes aren't always aware of that. And they say, well, the copayment, if you're here without insurance, is $180 a day, or with insurance is $180 a day. So they typically stop billing your insurance. And they just say, well, you can just pay us the bill. You don't want that to happen. You want them to bill your insurance because of your maximum. Very important. I had a lady that happened to her 2 years ago. Nursing home for 3 months, came home fine, but she got a bill for $15,000. And we found out that they never actually billed her Medicare Advantage plan. So we had to go through all this rigmarole, got it done, and got the bill down to $6,000. So it is very important to make sure they are billing you for your services. There is a new open enrollment period from January 1st to March 31st. So it used to be a Medicare Advantage plan you can only change from October 15th through December 7th. Now the rule is you have a backup opportunity to make a change from January to March. This is not going to be advertised. No one is supposed to come up to you and say, hey, there's a new enrollment period, you can make a change. This is meant to be a fix in case something happens that we're not be able to predict. So say you sign up for a plan. Everything's good, medication's good, doctors are good. January 1st, you're in the plan, you get a letter on January 5th from your doctor saying, we don't want to take this plan anymore. Or you get put on a new medication that you weren't expecting and it's super expensive with your plan. This opportunity with this enrollment period is meant to fix that so that you can make a change and get on the right plan to cover your specific needs. It's very helpful. We're really happy that they brought this back because, again, there are certain things you can't predict. And it's nice to be able to give or have an opportunity to make a change for an unforeseen circumstance. But this is not an advertised opportunity. So no one should ever come up to you and say, you still have another opportunity to change this because you want to. It is a backup plan in case there's a mistake. This time of year, and it almost feels like every time of the year now, there's always someone who's trying to get your information. All right, there's someone who'll call up and say, I work for Medicare, or I work for Social Security, or I work for the police department, and if you don't talk to us about your situation, you're gonna lose your benefits. It's ridiculous. I feel like we should have better protections over our phone systems, but we don't. So to make it abundantly clear, no one from Social Security or Medicare will ever come to your home, ever. Okay, if anyone says I'm a Medicare specialist, you close the door on them and you call the police because that is illegal. They're not ever supposed to call themselves that. Okay, no, the only way they'll ever come and talk to you is over a letter. They'll never even call you. All right, Social Security does not have the manpower to call every person if they have got an issue. They will send you a letter, and they'll ask you to set an appointment with the local Social Security office if there is a problem with your Social Security Medicare. So keep that in mind. If there is a need that they have to get in contact with you for, they will send you a letter, and they will ask you to set an appointment up at the local office. No one will ever come to your home, ever, okay? There's a running scam going on right now where someone will call someone like in an apartment complex or a living community like Pheasant Hills or something like that, and they'll call up and say, hey, your neighbor got diagnosed with COVID. If you give us your information, we'll go ahead and get your COVID set up, and we'll come, or COVID test set up, and we'll come out to your house and take care of that for you. This is happening right now, which is, again, ridiculous. So no one will ever do that, okay? If there's a COVID concern, your doctors will get in contact with you, the State Department will get in contact with you, or the Health Department, I should say, but no one else will call you and say this, that, and the other. They'll always do it through the proper channels. If it doesn't sound right, don't do it, okay? If someone says, hey, we're gonna, give you all these great services from this plan, you really want to see that on paper from the insurance company. There are guys who write down all these things that these companies will do, and they just hand a piece of paper to you. That doesn't mean anything. You have to see it on the letterhead from that company stating these are the extra services we're going to give you. It's very important for that kind of situation. All right, we're running pretty good on time here. I'll try to hammer this out and get you guys on your way. So again, our process is different than everyone else. What we do is we provide T, which is our funny little acronym, which stands for True Extensive Analysis. So choosing the right plan is never going to be based on what we get out of it. When we started this organization, when I started working for this organization, they made that abundantly clear. We're never going to be worried about how we're going to benefit from having this conversation with you. We're only going to be concerned about what is in your best interest. And we run that way, and that's why this thing has grown the way that it has. So first off, we do the prescription analysis. That is very, very, very important. Just because you take a couple simple meds you should not assume that it's going to be the same every year. These plans can change a lot, and you want to make sure your medications are going to be covered. We also verify your doctors, which labs you want to go to, your pharmacies that you want to go to, your gyms, your dentists, all that fun stuff. So we make sure that you go to the proper place so that you spend the least amount of money. Also, if you're worried about travel, if you're going to be traveling, it's very important to make sure your plan will be effective wherever you go. All plans will cover you nationwide for an emergency, no doubt about that. Even the HMOs, you can go across the country, and if you have a heart attack, you're covered, okay? But if you want to see a doctor because you're living in a space for 2 or 3 months, that does not mean you're necessarily covered. So again, you want to make sure your plan will work wherever you're going to be. Budget is a huge part of the equation, okay? Average Social Security check for most Americans is like $1,300 a month. And if your insurance plan is costing you $300 a month, that is something that you really need to consider and really think about for your future. Because, last thing we want, again, is someone who says, I can't afford to pay for my medications, or I can't afford to pay for my food, or I'm going to miss a rent payment because of my insurance costs. We don't want that to happen to anyone ever. So keep your budget in mind. That's what we do for you guys. We also have our own program called Medicare Now. It's a website that we use that allows us to type in all your demographic data, your birthday, your address, your zip code, but also lets us save your medications, which is huge. So then every year we can call you and say, okay, have your medications changed? And then we can click through and we can look at all the differences, and then we can send it right to you and say, here, this is what it looks like for next year. We're pretty happy with it. Or you know what, there's another plan that makes more sense based on your situation, and this is what we think you should do. Okay, it's a fantastic program, and it'll make us far more efficient for the future. Our primary goal, again, is advice. This is a nonprofit, which is not about us or what we can make off of you. It's all about advice. We do not want you to change your plan every year. That's the last thing we want, because that's a headache for you to have to worry about, does my doctor accept it, or do I have to go to a different pharmacy, and yada, 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 yada. What we want you to do, though, is we want you to get that checkup every year on your plan. Don't just assume because your premiums didn't change, or your medications didn't change, that it's going to be exactly the same plan as it was for the next year. Some plans can get way better. Some plans can get way worse. So we want you to have that checkup every year to ensure that you're in the right plan. If you're not getting that checkup from your agent, please let us know. We'll be happy to help you out. Core to our business, if the plan you already have is the best plan, we will tell you. If you're a state employee and you have retirement benefits through the PBTF, or you're a teacher and you have benefits through PSERS or HOP, or you work for Hershey Foods, or you work for Penn State Health and you have a good plan, we're not going to tell you to change. Not at all. I don't believe in that. It's not fair to our community to just try to make a sale. So a big deal for us is we'll never tell you to change if we already know you're in the right plan, and we'll show you that you're in the right plan at that point in time. If you have an insurance benefit and your plan is already the best plan for you, but you don't have an agent that calls you, we can become your agent. We can be your agent of record for like companies like Aetna or Gateway or whatever it may be. So keep that in mind. If you are not getting the service that you think you should be getting, please reach out. We'll be happy to help you out with that. Now, again, rely on us, set an appointment. This is that time of year where people talk about their Medicare plans. So if you do want to make a change or do want to set up an appointment, please reach out as soon as you physically can. We only have till December 7th, and we got Thanksgiving around the middle of that. And there's always the risk of, COVID shutdown. So if you do want to talk about your insurance benefits and you already have Medicare, please reach out as soon as you possibly can. And I'll put up my contact info up here. And then Ashley will be able to give that to you as well. So these are some of the companies that we work with. There's many more than that, but these are just some of the companies that we're licensed with. And again, our goal by being licensed with all these companies and going through all that headache every year is to ensure that you have the right plan, that you're getting clear advice against every other plan out there to make sure you're going to spend the least amount of money and get the most amount of care. So with that being said, here is my contact information. You can call me. I have an office here in Harrisburg, right on Front Street, north of the Governor's Mansion. So we do have parking, and we can keep it sanitized, and we wipe it down all the time. Or you can always email me, and I'll be more than happy to help you out with that as well. So please reach out, and I'm going to turn off, well, actually, I'll leave this up here, and what I will say is, there we go. If you have any questions, go ahead and ask them to me.
Great, thank you, Jay. We do have a couple questions in the chat box here.
Oh, okay. Let me see if I can bring that up. Or chat. Okay. Let's see if I can see it. Okay, there you go. If you have Medicare medical assistance, okay, what part does MAs play in this? So if you're classified as a full dual eligible, so you have Medicare as your primary, and then you have Medicaid, so your access card. In that instance, you're basically having Medicare as your primary and your medical assistance is kind of like your secondary. So with the Medicare Advantage plan, that kind of goes on top of both of those plans, and you're going through that insurance company for all of your services. So there's a lot of companies out there. There are companies like Gateway and Aetna and UPMC. They're all HMOs. So actually there's one that is now a PPO, but most of them are HMO vehicles. They do provide extra services like transportation, dental, vision, over-the-counter benefits, but it's vitally important that if you are looking into one of these types of plans, that your network reflects the doctors you want to see. There are a lot of plans and a very wide variety of networks. So just because this plan can give you all the greatest benefits doesn't mean that every one of your doctors sees it. They're very good though, and I think it's a good option, especially if you're in need of those extra services, the dental, the vision, the hearing, and those kind of things. If that makes sense, I'll move on. If anyone has a question about that statement, I can go into more detail about that. Okay, so if you're covered, okay, let's do the second question first. So how does a third party work? Example, Allied Health with Aetna as the medical administrators. Allied Health with Aetna as a medical. That from Cynthia, is that relating to the Medicaid question again? Because typically right now, oh, I understand. So like United Healthcare and AARP, right? So AARP is the name, but United Healthcare is the administrator. It doesn't really change anything as far as the care is concerned. It's just the networks that they're going to use and the underwriters they're going to use to offer the benefit. So just because it has AARP doesn't mean it's AARP everywhere. It's just their underwriting model for that design. So it doesn't affect it. It just it allows it to be more, I guess, better at spending their money on the care for that point in time by having the third party underwriter. If you are covered under an employer's company health plan, do you have to sign up for Medicare when you turn 65? All right, great question. So if your employer has more than 20 employees, then you do not have to sign up for Medicare Part B. But I would tell you, if you're paying, you know, say $200 or $300 a month for your health insurance, you might want to look at Medicare Part B. It might be cheaper for you overall. Now, if your company has less than 20 employees, they do want you to sign up for Medicare, okay? Now, as long as you have health insurance from an employer and your employer has over 20 employees, you will not be penalized for not taking Medicare Part B when you decide to. So my dad was 75 before he took his Medicare Part B. He was insured through his employer, and as long as he was able to show that he was insured through his employer, they did not penalize him for when he started his Medicare Part B and also his drug plan, okay? And how can we access the recorded webinar? That is on Ashley.
Yeah, so Jay, if you're okay with it, we will post it on our Facebook page as well as our YouTube channel, and I can email links out to participants. If you'd prefer, we can keep it as a private link on YouTube, and I would just share that out with the registrants for the program. If
you think it was a decent presentation, I'll go with it.
Okay, I thought you did a really, a really good job. So everyone, I will send out an email with Jay's contact information in case you don't have a pen and paper on hand to jot that down, as well as links to the recorded webinar.
Awesome. Well, thank you all so very much for attending today. And you've got my contact information. Ashley's going to send my information out again. So please reach out. I'll be more than happy to help you out any way I can.
All right. Thank you so much, Jay. Have a good night, everyone.
You too.